This is Ruth Brogdon from the Center for Asian Health at St. Barnabas Medical Center.
Hi, this is Winchi Kent. I'm from St. Barnabas Medical Center, Center for Asian Health.
Thank you. So Emily or Erica, would you like to go next?
Sure. This is Emily Haynes. I am with the Partnership for Maternal and Child Health of Northern New Jersey, and I'm the Director of Public Health Initiatives here. So I oversee the immunization programs, including the Essex Metro Immunization Coalition.
And I'm sorry, Emily, I didn't catch the name of your organization again. Did you say Partnership of New Jersey?
Yes, it's the Partnership for Maternal and Child Health of Northern New Jersey. We're a mouthful to say.
Yeah, that's great. So we know folks from there, and of course DOH funds that coalition on some level, and I think Angela Centellis was working with you at one point. She now works for New Jersey Hospital Association.
She was
it might have been before my time.
Oh, okay.
Yeah.
So are you?
I started in November 2015.
Well, welcome.
Thanks.
On by then. We're happy to have you. Okay, thank you. So, Erica, do you want to go next?
Sure. Hi, this is Erica. I am the Adolescent and Adult Immunization Coordinator with the New Jersey Department of Health Vaccine Preventable Disease Program.
Thank you very much. It looks like maybe one other person is trying to join now. I introduce myself. I am Carolyn Daniels. I'm the Executive Director at the New Jersey Department of Health Office of Minority and Multicultural Health. So again, welcome to everyone. We are going to now move to our review and approval of our November 16th meeting minutes. We actually had this meeting scheduled for last week, but it was the day after the big snowstorm, and we thought most people who had been out that Tuesday would need Wednesday to regroup and get themselves together. So we do thank you for joining us today. But if you have received the meeting minutes from November 16th, I would like to open the floor now and ask if there are any additions or corrections that need to be made. And so if not, can we just approve the minutes of Sue, Ruth, and Winchi?
Sounds good to us.
Do
we have a move? Do we have a motion to accept the minutes?
So I'll move. So moved.
Anyone can second it?
You can second it, Ruth. It's fine.
I'll second
it.
Yeah. I don't know if I could do that.
Yes, so we're a small group today. One of our challenges, Emily and Erica, as you may be aware of, is really reaching out and getting people interested in participating in the coalition, and then being able to have them to stick with us. We also do know that some of the people on my end from the Communicable Disease Department that usually participate, 3 of them also indicated that they would not be able to join us on the
Sorry, that's me, sorry.
Are we good?
Yeah, I think we're good.
Good.
Okay.
I think we were having some background noise between our 2 computers here because Wendy and I are sitting together.
Okay. So we also have, where's my list? Oh, it's down here. So the next thing we want to do is talk about one of the things that we are trying to do to attract new members and to inspire and incentivize our standing members is to create, we've created a steering committee, and you should have received, and if you didn't, please let Ruth know at the end of the meeting, ladies, and she can send it to you. It was an open letter that went out to the coalition. It basically...
Dr. Daniels, I actually have to make a correction on that. Dr. Wong was taking a final look at it. Her intention was to talk about it today, introduce it, and then we would send it out very shortly after this meeting. So she was taking her final edits on that.
So you guys will get that shortly. Basically, it's a letter from Sue and I, just really highlighting the coalition itself, what we have achieved since the inception that started back in 2013. So it's a nice chronological listing of some of our accomplishments, which I think is nice to provide at the end of the year so folks can look back and see the work that has been done through the coalition. And the coalition, of course, consists of the individual efforts of folks like you all that are on the call. So when I say the coalition, I'm using it pejoratively. So I want people to understand that we are always interested in the work that you are doing through your organization, your agency, in any way, shape, or form that it relates to addressing a viral hepatitis. I think we're also going to look at how we can maybe zero in a little bit more effectively in reaching the right people. But the letter talks about those chronological achievements, and then it does go on to extend an invitation to our coalition members to consider joining what we are referring to as our newly created steering committee. And so we like to think that there's some benefits to doing that. Any member can indicate that they want to be part of the steering committee. We actually want to get input from that committee so that through their leadership and experience, they'll be able to help us shape the direction of the coalition. Right now, what we actually do is we are following pretty much in sync with the strategic approach and the strategic plan of United Hep B, the foundation. And I'm sure we'll continue to do that, but as a local organization, there are other directions that we can also take and other things that we can include. So part of what you would be able to do as a steering committee member would be to contribute to our direction, but then you'd also be eligible for things like once every year the United Hep B sponsors a big conference in Washington, D.C., and the I think it's 18, and maybe more than 18 coalitions from across the country all convene and come and talk about what they are doing, their initiatives, their programs. We've been fortunate in being able to send someone every year. So as a steering committee member, you would be eligible for consideration to participate in that conference. There are no expenses incurred with that other than your evening meals. That may be Winchy, if you remember correctly. I think that's right, but the Hep B Foundation pays for the travel, it pays for the hotel room, and I think the breakfast and lunch because it's part of the conference, and then I think you're on your own for dinner. But it's an exciting thing because it's an opportunity to meet with other people across the country that are also working on hepatitis initiatives. And so that's one benefit of joining the steering committee. The other is we know from time to time organizations apply for funding through NIH or CDC or any of those federal organizations, HHS, under the HHS umbrella. And so as a steering committee member, you would also be the recipient of a letter of support from the coalition signed by myself and Sue in support of your initiative or the funding that you may be seeking. So I think those are pretty good incentives, and I hope that you guys that are all on the call will think about joining the steering committee and being able to. I have to pick up because my office is next door to another and the walls are paper thin. Sorry about that. So the benefits I think are really good. We will be happy to provide those letters of support and references like I mentioned the expectations for the steering committee members would be that you would also participate in our regular New Jersey Hep B Coalition calls like these. And then what we think we would do on a quarterly basis is have the steering committee possibly meet and strategize before the regular coalition membership meeting. So maybe that first half an hour would be the steering committee meeting, and then after that we'd have the meeting scheduled for the hour session. So Ruth and Winchie, did I leave anything out? I think that's it.
I think it's pretty much, it's Winchie. I think it's pretty much covered, but I just want to mention a little bit, like for the conference that,
sure, go ahead.
The conference that you mentioned about for the Happy Foundation, that's we call it Happy United Summit, and then they invite different different coalition from different states. And then I think the year before last year, we have about 50 people participate. How many people, Ruth, for last year? It's about 50, right? Yeah, 50 to 60 people.
I would say about 60 people.
Yeah, it's a very good chance to also showcase your program in your organization. And then it's very good opportunity to really meet with the other people from the other state, and then also understand their program, feedback, some good feedback about the program. And then I am so honorable because they invite me to be one of their summit committee this year. So definitely I will be there from July 26th to 28th. And then so that's a very good opportunity to, the first is to showcase your program, and second, of course, I know about what the other state doing, and then also share your experience with the other people, and then get some of good information from the other state and the other programs.
I'll just add, last year one of the agenda points that I thought was very impressive is, we're in Washington, D.C., and they were able to coordinate the attendees of the summit to meet with their local representatives in Congress and be able to talk about hepatitis B, the need for screening, testing, legislation surrounding it, and I just thought that was an incredible opportunity to be part of that as well. So hopefully that'll be again on the agenda. So it is a great summit if you're able to participate.
Yeah, and then this year we are still working on it, and then definitely we will go back to the hall again, and then instead to meet with all of the congressmen and senator, this year we're going to have a showcase to present that what we did in our state to all of the Congress and senators. So that's a very good opportunity to participate. And then, so that's a really good benefit to be a member of the committee, because that's a very huge benefit for our member to participate in this kind of events nationwide.
Okay, thank you, ladies. And I do just want to punctuate the fact that what Ruth mentioned, there is a day that is dedicated during those 3 days. I think the conference takes place, and they meet with it's lobbying on the Hill. So that's really exciting, and you get an opportunity to meet the elected officials that are really involved in facing this initiative. So thank you. We're going to move on to the next issue here. I think maybe unless Winchie, you or Ruth can do number 4, I'm going to skip to number 5.
Yeah, we can actually talk through it, and I think Dr. Wong's on the phone. Dr. Wong, are you on the phone?
Yeah, I'm in the car, so I'm not sure if you guys can hear me okay, but I just called in. Sorry, I was at Essex County's Women's Month celebration in New York when somebody from our hospital got an award, so I'm just driving back to that. So I'm on. I can't see any slides or anything, so definitely Ruth can lead on doing the presentation. And I'll try.
Yes, it's okay with everyone. I'll pull up the slides. I'll start speaking on it. I have Wenqi and Dr. Wong on the call, so they can definitely jump in and add in, if that's all right. So we'll keep with the agenda.
So we're going to move on to the CDC reverse site visit and presentation.
Yeah.
Okay.
So I just want to also, I have Wen-Chi here also. Wen-Chi is my colleague that works with me on the CDC Hepatitis B project, and she works with me also on the coalition. So when you do when you hear or receive these communications regarding the coalition, it'll be either myself or Wen-Chi, as we've been working on this now together for almost 2 years. Wen-Chi started a little bit before me. The grant was awarded to St. Barnabas back in September of 2014, and it is a 3-year award to St. Barnabas Medical Center, and we have a another site that participates with us, Charles B. Wang Community Health Center, and FQHC in New York City, which Dr. Wang has a very rich history with that I'm sure she'll jump in and share with you. But we recently, our grant is coming to an end, the end of September of this year, and as part of the process, CDC had asked the 3 sites that were awarded this grant, us being one of them, a second one being the Asian Health Coalition in Chicago, and the third site being the University of, they're in Sacramento, University of Davis. Is that right, Dr. Wang? Davis? Now
UC Davis.
UC Davis.
Yeah, UC Davis.
So we are the 3 sites that were awarded the 3 years, and as I said, the grant is coming to an end, and as part of the process, they'd invited the 3 sites to visit them in Atlanta. We just came back from that visit. We were there March 9th and 10th, presenting to the CDC our findings, and it was a great opportunity not only to showcase what we did, but also to hear what the other 2 sites were doing in terms of screening and linkage to care, in particular in foreign populations. So in New York City, it's estimated there's a 1.2 prevalence of hepatitis B virus, and since 2007, we have been seeing those cases decreased, but there has been a slight increase since 2013. In 2015, approximately 7,700 people were newly reported with chronic hepatitis B in New York City. The positive part of working with New York City is their centralized health department. They provide an annual hepatitis B surveillance report and many hepatitis B resources and programs. Dr. Wang, do you want to add on that since you've worked in New York City with CBW?
I think basically they wanted they kind of the whole premise of our project is there's a lot of work that's been done in New York City and a lot of resources that are available for a concentrated Asian population. And in New Jersey, we have quite a number of Asians and a rapidly growing population, which Carolyn has been very familiar with being in New Jersey for longer. And so the challenge was like, how do we bring a similar kind of model to New Jersey where it's needed, but there are fewer resources? And if you look at we don't have good surveillance data in the same way that New York City does, but we know the population is very diverse, and thus we believe the burden of hepatitis B should be pretty high as well. So I think CDC in Atlanta recognize this, and we're really excited to help us with this project.
So as Dr. Wang had mentioned, there's really, the burden is very high, particularly in New Jersey with the high number of foreign population. In particular, 21% of New Jersey's population is estimated to be foreign-born, and New Jersey's Chinese population has increased by almost 30% between 2000 and 2010. So there's definitely a lot of diversity points, but there's no data available, which was one of the reasons why we had submitted for this application and thankfully was approved for it. We have found that the physician knowledge of hepatitis B is quite low, that greater than 70% of physicians do not perform liver cancer screening for hepatitis B, and 50% do not test household contacts of hepatitis B patients. And in contrast to New York City's health department, our township structure, we have a very decentralized and fragmented public So the challenge is a little bit greater for us in Jersey with working with so many different health departments and health departments that are not necessarily staffed by full-time personnel in connecting those patients that they have, they know or have been identified to them as having hepatitis B. Okay, so this was mentioned by Dr. Wong. So we St. Barnabas Medical Center had adapted their program of screening and linkage to care over at St. Barnabas Medical Center with a little bit of a different approach, where we were developing a multi-pronged hospital-based program that was culturally targeted. We wanted to raise hepatitis B awareness, increase screening for our Asian Pacific Islander population. And we did this through different community events and partnering with different community-based organizations. We were able to leverage partnerships with these organizations to reach at-risk populations. We also screened in our primary care-based screening, the Center for Asian Health, and also a resident faculty practice that I'll talk to you a little bit about. Charles B. Wong did continue their primary care-based screening and hepatitis B care. And this is just a picture of the two teams. You can see Dr. Wong, myself, at the lower right over at St. Barnabas, and then we have our Charles B. Wong Hep B teams over to the left. So what our screening approaches included primary care-based screening at Charles B. Wong and at St. Barnabas Medical Center, as I mentioned, at Center for Asian Health, and at IMFP, which was a resident faculty practice. Once we had it set up in Center for Asian Health, we introduced it over at IMFP, bringing the screening protocol over to the residents. I mean, this is a great opportunity because this had 5 attending, over 30 residents in a teaching environment, and teaching them the importance of screening based on not necessarily only being foreign-born, but those guidelines from the CDC and the USPTF guidelines. We have also employed a very unique approach in screening with using our hepatitis B coupon. This coupon, and I have a picture of it in a later slide, the coupon served as both the payment and prescription. And on the back of the coupon were many various different sites that the patient would bring in the coupon and present it to the lab to have a full Hep B panel drawn. We also screened at many various community events and also advertised through ethnic print and an online campaign with the CDC. Here are our overall screening results with both the sites. For the 3 years, both sites had a target of screening 3,000 patients, identifying 375 positive, linking greater than 240 to care, and linking was noted as being in care and attending the first visit. And we had a goal of greater than 90% receiving HPV-directed care. So you could see for where we are at the end of December, this data is, we're on target, and we are hopeful that we will make these targets by the end of September. So up till December 2016, we have identified 242 positive HPV patients, of which 230 have been directed with HPV care with viral DNA being ordered, and also ALT. Of those 230, 225 have gone on to attend their first appointment, 97 going on to attend their second appointment, and 39 are on treatment. And this is a slide just comparing the New York City and New Jersey demographics. You could see that they're about the same when it comes to gender, fairly the same with our median age range. With the birthplaces, there's definitely a difference where the majority in New York City are from China, 77% versus 27% in New Jersey. 34% in New York City did not have medical insurance, and you can see that translated as 60% having enrolled in Medicaid, whereas in New Jersey, 11% did not have medical insurance, and 47% in New Jersey did have private care insurance. And again, just a comparison of those that we identified as positive hepatitis, positive for the virus. 12% in New York City were identified versus 5% in New Jersey. You could see that about the same were immune by vaccination, and about a third in both sites are immune by exposure, with a little higher in at 34% versus 20%. Okay, so just looking at immunity overall, U.S. versus foreign-born at Charles B. Wang, you could see that about the same U.S. versus foreign-born in terms of having total immunity by our age range. And going on to the next slide, different here with New Jersey, the foreign-born definitely were more immune versus the U.S.-born. And we broke this out a little bit. Broke this out more by site, by immune from prior infection versus immune from prior vaccination. And those that were U.S.-born, you would imagine, as they got those that are older, they were less immune from prior infection as opposed to prior vaccination than the foreign-born. And if you break that out again in our St. Barnabas slides, as those that are older, that are foreign-born, were immune from prior infection versus those who were immune from vaccination, we see a difference between a foreign-born being a little bit higher in the young age group versus the older age group. And we have about the same in our 45 to 64 stratification. What we did a little unique with our project was we had a survey, which was honestly quite lengthy, and I have to give it to our team and also to our participants for filling it out. It was a survey that asked many different demographic and medical, social history questions to get an idea of what our participants, composed of in this study. And we did New York City did a smaller sample size of this survey, but we did compare between our sample and New York City the knowledge of hepatitis B transmission. And it's very interesting to see that in terms of knowledge in both sites, they're about the same, but both, what's interesting is that almost 50% in both sites did not realize that you can transmit hepatitis B by unprotected sex. Another interesting question was eating unclean food. Again, about 50% in both sites did not realize that you cannot have hepatitis B transmitted by eating unclean food. And that is very applicable with our Asian-born population, where there has been this myth that it can be. And, back in China, as I understand, there are separate tables at, in, workplace cafeterias for those with hepatitis B that have to sit because there's fear that they're going to transmit the virus to their other coworkers, or even family members being separated just because they have the virus. In terms of knowledge of the disease, something I thought was interesting here, about 50% did not have the right answer when it came to knowing, does hepatitis B cause cancer? So 50% of the population that participated in this survey did not realize it can cause cancer, and a large percentage in both sites thought the virus affects the heart as opposed to the liver. and also that it cannot cause symptoms was another. As you can see, there was a disconnect there as well. In terms of treatment and prevention questions, when we talk about treatable versus curable, you could see in both New Jersey and New York, about 1/3 of the population did not realize that it can be treated with meds, and greater than 60% in both sites thought that it is actually curable with meds. And we know that hepatitis B is not curable at this time. Okay, so looking at St. Barnabas specifically, these are just our many different community screening events that we have and our different CBOs that we partnered with, and you can see geographically how we've spread out. We're primarily up north, but we're spreading out across the state, and I have to say we're probably at greater than 50 community screenings right now. These two graphs are from our St. Barnabas surveys, and as you can see, we had the majority of our participants from China, 68% being Asian. This is a screen on the motivators for hepatitis B screening, and 41% indicating that they did the screening because they cared about their health. The various risk factors that were involved, did the person realize what risk factors that they had in possibly contracting hepatitis B? And this was a very interesting piece of data that we received in terms of health insurance. So 75% had indicated that they do have health insurance, and of those insured, 65% do have a primary care. However, of those who have a primary care provider, only 30% indicated that their primary care provider screened them for hepatitis B, where the remainder either did not know or indicated no, their provider did not screen them. So there is definitely some, knowledge here that should be shared with physicians on screening and the populations and the guidelines, and this showed this here. Okay, and this is just again on birthplace. Our Hep B patients, 85 we have identified, almost the same female and male, 30% being on antiviral therapy. 13 were originally uninsured, and through a lot of hard work with Wenchi, who serves as our patient navigator, and some insurance enrollment events, we were able to get 10 insured, and we have screened 108 household contacts of Hep B patients, Hep B positive patients. This is just a screenshot of our positive Hep B patients by age, where most of them are in the 36 to 45 age. And this is just a breakout of our patient profile of treatment and hepatitis-directed care for our Hep B patients. This is just a sample of our different community events and our staff. As you can see, it takes a village to make this happen. And as I've indicated, this is our coupon. I'm sorry, I didn't have the coupon's not on. Is it on there? Well, we have our poster. Coupon looks very similar to this, but this is some of our CDC materials that we were able to generate from the grant, and a lot of giveaways with some very good information, fact information, some just fun giveaways. And finally, we just said we wanted to thank our team for this project, and we had a big team over at the Medical Center and at Center for Asian Health.
Thank you.
Very good. So what type of response did you get from the funders after the presentation?
I think it was good. We had a really great conversation with the other grantees, because it was all a little bit different. The Chicago group worked with 2 FQHCs, one of which was a refugee FQHC, which was very different from, what's interesting, those people are in the middle of green card. Hold on one second, I'm going to just transition.
They're in the middle of
trying to get their visas and green cards.
Right.
And so they're a captive audience, and they obviously are all foreign-born. And they were able to get really good linkage to care because they're part of this whole process of getting their green cards. And I don't know if we have any, in New Jersey, this would be interesting if we had like an FQHC that targeted refugees, because it would be obviously a high-yield group in terms of screening. But we don't, interesting.
So we don't have the FQHC, but we do have a refugee program. Matter of fact, there's a new coordinator that just reached out to me maybe 2 days ago to introduce herself and to tell me about a program that's they have that's upcoming, and so I'll share that information. But no, I don't think there's a particular FQHC, but we do have a program within the Department of Health.
So it would be interesting to see, because it seems like it's very, I don't know, it seemed like at least on their end, it's very regulated in terms of what, like when they first arrive, what the certain tests that screenings they have to undergo. And so what they found is that they were getting surface antigen screening, but not that complete set of tests. You know, they weren't getting core, they weren't getting surface antibody, not necessarily getting immunized. And so it was a really cool thing to match them up, you know, with the CDC grant. And then UC Davis was more academic, but kind of a similar thing. And they worked with they did both they call it in-reach and outreach. They had a primary-based clinic and then also a lot of screening efforts. So, you know, there were, I think CDC was very, and I think they're proud of all the programs. You know, everybody's done a good job. And the question now is, you know, like, how do we sustain this and keep up what we're doing? Then, you know, the big question was, is there going to be more funding?
Right.
So I think
no one knows.
Nobody knows. We were just on a call with CDC, John O'Merman, who is the head of the division that houses hepatitis and HIV and STDs, and they announced, you know, global. There will be a global cut. It won't affect ours because ours is actually part of the last year's budget. But at this point, there's not like a next Hep B screening grant. But you know, maybe down the road. So.
Well, there may be hope yet, because I did see an article in the Associated Press this morning where Mitch McConnell, who's the Senate Majority Leader, is pushing back on the president's budget that was submitted in areas of particular interest are Medicare, of course, and NIH and some of the other grant funders. So he's staunchly opposed to those budgets being cut. Yeah, that's good news. That is. So there's hope.
There's hope. You know, and it may be that we look for grants in other areas too, you know, from other funders. So that's something, you know, maybe we can brainstorm with you or anybody else.
Good. Excellent.
All right. So yeah, we should probably go on with the agenda.
Yep. You can go ahead, Sue. We're at 5 coalition updates. I think we were going to talk about the November 30th New Jersey Immunization Network Conference, and that I think you spoke at, in the CDC grant online media campaign, and the Hep B United presentation that Winchie and Ruth provided to our New Jersey Hep B Coalition presentation that was provided to Hep B United during a webinar, and then the upcoming April 3rd Rutgers Public Health Symposium.
Yep. So a lot of that is just updating people on, you know, stuff we've done since our last meeting. And the immunization conference is really, you know, great. It was sponsored by New Jersey AAP for pediatricians. So there were a lot of kind of pediatric practices there, and so they had a lot of questions about Hep B vaccine and immunity, and it was great. I mean, there was a lot of interest, and Winchie and Ruth were at a table, and they were like swarmed with people, and we got quite a number of people who signed up for our listserv. Like, I don't know, do you guys remember how many? It's like a whole page, right? At least 50 people signed up. So we added them, and so they're at least getting our emails.
Good.
And, you know, hopefully we can get some of them to be engaged. But it showed that, like, people were interested in Hep B. So, you know, we'll continue with that. And we're working on a webinar that we're developing with the DOH. So once that's finished, we'll we'll let everybody know. So definitely everybody check out the Liver Be Well website. Ruth, I think, did you show a couple pictures of the online media, or maybe not? But so we adapted CDC's. They had a online campaign. I don't know, last year or the year before, and we basically adapted that and had it linked to our website, and then geo-targeted people in the New York, New Jersey region. It's just a kind of a novel way of advertising, since we know a lot of people are online getting their news and ethnic, on different ethnic websites. And we got quite a number of hits. Our kind of like click-through rate, which is one of the industry's measures, was higher than the national average. And we had a number of hits on our website also. It didn't necessarily translate to more screenings, though. I think people may or may not have been close to us. Like, we had a lot of hits in Jersey City and Newark, I believe, and they may not have been convenient to where our labs are. And then we actually had a number of international hits too, people coming in from international websites, like, I don't remember, Poland and Netherlands. Russia. Yeah, I mean, it may just be that people are looking for information and they're finding us, if they don't find anything in the language. So it was interesting. And then, yeah, Ruth and Winchie's presentation, that was probably recorded, right?
Yeah, recorded.
Okay, you guys have the link. Okay.
So you guys can find it on YouTube.
They did a good job. I was on the call. I heard them. Yeah, they did a good job. It was very, very comprehensive, and they made a good case. I love that we always, every opportunity we get, we're pleading for new members. So
we are, aren't we?
Yeah. But it was good. It was a good presentation.
So good job, guys. And then, April 3rd is the Public Health Symposium. And, I guess we just need to decide if we want to have a table like last time. I mean, Ruth, what did you think? You was from last year. You went last year.
We had good traffic. We definitely had good traffic. And Jennifer was with us that day, and she was talking about the perinatal dose and childhood immunizations. I think there was interest there on that aspect. Our table was a nice reflection from infant all the way to adulthood of hepatitis B. So I think it might be worth it to go.
Carolyn, do you know, is anybody else from the Department of Health speaking this time?
I do not know that, no. Okay. I would be surprised if Dr. Tan is not.
Oh, yeah.
Is anyone going to join?
Oh, why don't you look this up? Look at the speaker details poster session. All right, so why don't we tentatively plan to be there? I mean, it's good to like recruit the public health crowd.
We should send out to all of the members and see that who would like to join with us. And then
see who's going. See if any of our members are going.
Yeah.
Maybe we can meet them in person. Actually, it might be a great way to actually meet people in person.
Yeah, definitely.
Forge stronger bonds.
Encourage them to join together.
All right, so next, I think we only have like less than 10 minutes. So national, international updates, there's a lot going on. The National Viral Hepatitis Action Plan was recently approved and posted. It's online. This is kind of the federal overall action plan for hepatitis, kind of trying to coordinating all the efforts from the different federal agencies like HHS, NIH, CDC. So definitely take a look at that. And then actually, I feel like it's just next week, the National Academy of Science, which used to be the Institute of Medicine, will be issuing their report on hepatitis elimination in the U.S. So they did part 1 last year, which basically said that, yes, it's possible to eliminate hepatitis, but it will require significant resources for us to do it in the U.S. And this is that was just the overall recommendation. Part 2 should have a lot more detail in it. And I think I mentioned before, Dr. Strom, Brian Strom, is the chairman of the committee, and he's also the chancellor of the med school at Rutgers. And he will be giving a webinar, I believe, next week for Hepi United on this. So I feel like, Caroline, we should figure out if there's some way we can capitalize on this.
No, I agree. Yeah, I think you're right.
He's in New Jersey. He's going to be like talking about this nationally.
Mm-hmm.
So I've asked Sally, our marketing folks, to find out if at least our system is going to somehow promote this or issue some sort of report on it. But yeah, maybe even the Department of Health, you guys can think about how we can, you know, bring more attention to it in our state.
And yeah, at least get it out there and be a little bit more visible. So yeah,
Right.
we should talk about it some, Sue.
Yeah.
I also, Ruth, I just sent you a link. I don't know if you can go to and show an active link during this webinar or not, but I did send it to you in the chat.
Oh, yeah. When she's got it on her
Okay, good.
link that Carolyn just sent in the chat.
So while they're looking at that to see if they can get into it, this is what happened. Are we ready to move to number 7?
Yeah, go ahead. You know
okay.
what? Can you send it again? We don't see it in the chat.
And then send to.
Did you? Or yeah, you can send it to everyone.
I sent it to Ruth. Maybe I should have sent it to everyone.
So why don't you send it to everyone? Because then when
send it to everyone. Let me see. Okay, here. Paste.
Oh, never mind, Kara. Wait, but Ruth, are we able to see your screen?
You got it?
Okay, Ruth.
Yeah. Oh, good. Great. There it is.
Oh, our website. Yes, our beloved website.
So this, what I wanted to share with everyone, is so exciting to me. So our New Jersey Department of Health, what you're seeing now is our home website, and what we are continuously doing is looking at how the department can become more culturally and linguistically compliant, knowing that we have over 100 different languages that are spoken in the homes of our New Jersey residents. So we came up with this idea of, you know, it can be expensive to get someone to go in and translate your web pages. So if you guys scroll all the way to the bottom of the page, of this web page, if you go all the way down. So do you see that? It says select language over to the far left at the bottom of the page. Click that.
Yeah.
Click that button and see if it'll open it up. That's the Google Translator, and what it will do, look at all the languages. Click one, and it will change the entire web page into that language. Look at that.
Cool. So this is Google Translate, right?
That's Google Translate. That's pretty cool, right? Look at that. And
yeah,
it has every language you can think of in there. And
so
it
we
changes.
should add that.
And I think we should add it to our New Jersey Hep B webpage.
Yes, I was thinking the exact same thing.
I don't know how, because our IT person did this for us, so I don't know if you guys, you know what though, I could ask her if she could put it on our website.
It's like a widget you somehow add on. We just have to go through our web builder thing again. And just
I know, but look at all the languages that it can translate into. That's pretty cool, right?
Yeah. Can you read it, Ruth? Can you read it? I can't read. But you know it's telling you.
Yeah, it's only like GPIGs and pictures with narrative and things like that. It won't change, but any of the content that's in the website, it'll change the content into that language.
That's amazing.
Yeah, I love that.
Yeah, I'm sure it's not perfect translation, but it's at least a rough idea of what the website's about.
Yep. And so I wanted to share that with everybody to say, maybe this is something we want to consider. We should do this for our own website. So thank you.
No, thank you. Definitely. Yeah, cheaper than hiring a translator.
It really is. It's very expensive when you send things out to be translated. I know it because I've done it before. So.
Yeah. All right, good.
And I think that's it. Yeah, I think that's we are also approaching Minority Health Month, which starts in April, and you can go, if you scroll back up to the top of this webpage that you're in and click on Public Health, and then go to, see that orange box up at the top, Public Health, all the way at the top there. Yeah, click that, and then when you now find Minority Health, click Minority Health. It'll take you into our website, and if you go all the way over to the right under What's New, you'll see Minority Health Month Calendar. You can click that below. See that under What's New? You know, there you go. And it'll take you right into and you can scroll down, takes you into our live calendar of events. And those are all the events that are taking place that we have from community partners across the state that are uploading. People are still uploading events. We are, I think we're at 65 events right now.
How do we can upload our own stuff, like any members can upload?
Well, you would need an authorization code. The best thing to do would just be to send your information to Sudha Sharma, because she's the editor of this, and she can.
I think we did this last year. So
I think you did. Yeah, I think you did. So if you have any events that you guys are sponsoring, any screenings or anything like that in the month of April, send those to Sudha, and then Sudha will upload them. We can get you an authorization code, and then you could do it yourself. But it's just easier to have her do it. Last year we had maybe 82 or 83 events. Some people do a series of events, screenings for a whole week. Some people do something once a week. Some people do something, in a one-time event. So it depends on what your resources are and what you want to do. But they're all events targeting one of the minority racial or ethnically diverse populations in New Jersey. So we'll be doing that for the entire month. We also sent out, and I think, Ruth, you sent this out to all the coalition members, those announcements about the upcoming health equity forums. Does that sound familiar to you, Ruth?
That got forwarded.
Yes, and so we're partnering with, our office is partnering with the American Heart Association, American Stroke Association, and a county health department, 3. One in Passaic County, one in Monmouth County, and one in Cumberland County, to provide a health equity forum. These are half-day sessions. Folks who are interested can apply for public health credits. And what we're doing is working with the county health department's CHIPs, or the CHAS being the Community Health Assessment Plan, or the CHIP being the Community Health Improvement Plan. So they do the assessment first, then they develop a plan, an improvement plan. And the improvement plan targets, one of the health disparities, or the top 3 in their area. And so what they're going to share is data and information of what they've been able to accomplish over the last year. And then we also have speakers from our NJ Shad State Health Data Assessment Department that's coming to talk about a new component that you can access, and some elected officials and dignitaries. But the focus of the day is going to be on what those local folks in those communities are doing. So very excited about that too. So that's our update.
All right. Well, we have run out of time, so do we have anybody who wants to do a quick update on their end? I think some other people have left already.
Yeah.
All right. Well, if there's nothing else, we'll close it, and then we will, work on some of the stuff. Yeah, we had talked about, I think we should figure out also if members want to do anything together for the National Hepatitis Testing Day in May 19th. So we'll try that. And then, if you haven't already signed up for the No Hep campaign, sign on online. And I think that's it. There'll be a lot of exciting stuff happening this year.
Be good. Great.
All right. Thanks, everybody.
Okay, thank you. Bye.
Bye-bye.